What I'm going to talk about today is clinical education and radiography programs. This is the last in a four-part series where I've discussed what a radiographer is, how to apply to and increase your chances of getting into an X-ray program, how to be successful in class. Those are the didactic classes, and this one is going to focus on clinical education and how to develop professional attributes that will help you in your career. So to start, I want to discuss what clinical education is. You may be familiar with terms such as internship, preceptorship, and things like that. And clinical education is similar to, but not exactly like that. It's the part of the curriculum where you work with patients in the hospital and actually do the job. So you're going to learn the procedures, you're going to learn how to deal with patients, you're going to learn how to deal with professionals, be those radiographers, nurses, respiratory care, medical lab, and doctors as well, so ER doctors, surgeons, and radiologists. So you're learning to become a professional, you're learning to actually do the job. So clinical education is probably the most important part of your medical health care training experience. You can learn to pass the test, the credentialing exam, and you can do well on that, but if you don't develop the skills that you need and the personality and the professional attributes that you will need to be successful in the job, you're going to have a hard time seeking, finding, and keeping employment. So it's very important, the clinical education is. We're a little bit different than some other medical professional training programs. For example, nursing. Somebody can go to a nursing program and get a great education, but the clinical education portion of most nursing programs, at least in my region, is lower. The requirements are lower than what they are in radiography programs. The reason for that is because a nurse graduates from a program and they go to work in a hospital and they perform a preceptorship where they're working under the direct supervision of another nurse for a year before they work on their own. And in our specialty in radiography, our technologists are expected to graduate from the program and be ready to go to work at graduation. So we have to do more clinical education than what some of the other specialties require. So you have to be ready for the workforce whenever you graduate from the program. So you have 2 years to go from somebody who's never worked in healthcare to a point of competence and ready to go to work. So very important. So the challenges that you run into as a student are, first off, anxiety. Most of the students, I would say, that we receive have never worked in a true professional environment before taking a clinical position or a position in a program where they start their clinical education. So working around people who are doctors and surgeons, also doctors, physician's assistants, radiologist assistants, technologists, nurses, and so forth, it can be a little bit stressful. It can be a lot stressful, especially whenever you throw the patients into the mix and the patients are hurting or sick and they don't feel good, and sometimes they get pretty grumpy. So anxiety is an issue. The anxiety that comes along with what we do specifically, we create a beam of radiation to pass through a patient, and that comes with its own level of anxiety. Some people find that to be a little bit scary. Other challenges are the assimilation of classroom information into a clinical setting, and what you're going to find in your clinical education is a lot of cases the technologists are going to say that they're going to show you different ways of doing things that aren't in the textbook. That's perfectly fine. There's a lot of ways to get to the same outcome, and your job as a student is to take that information and whatever works for you, put it into your toolbox so that you can use that and become a better radiographer. The problem is that our classroom instruction, the purpose for the classroom instruction is to teach you what is going to be on your credentialing exam. So we're not going to teach you in class all the tips and tricks that you're going to learn in clinical education. So sometimes it really feels like there's little little connection between what you learn in class and what you learn in clinicals. Personality conflicts. You're going to be dealing with a lot of different personality types, a lot of different people in the hospital. So you're going to have to learn to deal with conflicts and personality differences in personalities, and you're going to have to develop a thick skin to start with, but also you're going to have to develop a means of conflict resolution. We'll talk a little bit more about that in your chain of command and how to address some of those issues. And then because we do so many clinical hours and because the didactic education is so strenuous, by the time students get ready for graduation, they're already feeling a little bit of burnout. So to combat the burnout, I kind of addressed that in the last video on studying. You've got to do something for yourself. You've got to get out and you've got to go do something to kind of relieve the stress and have some personal time. So in your clinical education, we're going to get to a really busy slide here in a minute, but the attitude that you bring into clinicals is going to make a world of difference in what your clinical education is going to be like. So you need to remember that every day that you get into clinicals is like a job interview. So you're going to be working with people, you're going to be showing them what you can do. It's an extensive job interview. Most of the time you don't do some sort of performance on a job interview, but in this case, it's every day you're developing the professional attributes, and you're also developing the professional skills so that whenever you graduate, the goal is to have a job offer on the table at the point of graduation. So every day is a job interview. If you're in clinicals and the burnout has gotten to you towards the end of your clinical or the end of your educational program, then it's going to affect whether or not the hospital that you're doing your clinicals in is going to want to hire you. A little bit more on that here in a bit. You might not want to go to work in the same hospital where you did your clinical education, and that's okay too. But every day is a new day. Every day is a new opportunity. So if you have a bad day, even if you have a bad semester, then you have the opportunity to improve. Every day is a new day. Every semester is a new semester. So, but you have to have the expectation that you're going to progress. That's a self-expectation. The hospital is also going to have that expectation on you as well. So you can't be a third semester student struggling with the same things that you struggle with in the first semester. So a little bit more on all of that later on. But what I'm going to talk about next are the things that you need to do before arriving and when you do arrive at your clinical site. So before arriving, make sure that you're well rested. I know most of our students are young, and because of that, sometimes you want to go out at night and do things before you get up and go to clinicals or class the next day. But that's going to be reflected in how you come into clinicals. So you want to be well rested, get a good night's sleep before you get there. It seems like it should be obvious, but be bathed and well groomed before you arrive at clinicals. If you're showing up at clinicals and your hair's a mess, if you wear makeup and you're having to apply your makeup whenever you get to clinicals, and your uniform, it looks like you used it for a pillow the night before, it's going to be frowned on. So make sure that you also get your shower so that you're free of objectionable odors. So wear clean clothes. Make sure the clothes are not wrinkled up and looking again like you slept in them, but free of objectionable odors. And there's a lot of different types of objectionable odors. So obviously body odor is one. If you show up to clinicals and you smell like you've been working in a field all day, you're going to smell bad. That's number one. Number two is that you can take it to the opposite extreme and you can try to mask some possible objectionable odors with colognes and perfumes. The problem with colognes and perfumes are that some of your patients will be allergic. So if you walk into the patient's room, you might give them a respiratory response that you don't want to give them. So if you wear cologne or perfume, you want to make it minimal. And then certainly you want to wear the right shoes. And the right shoes are for your protection and also for your comfort. So you want to make sure that you wear some shoes with some good arch support, some good cushioning in them. You're going to be on your feet a lot. But also, in our program, we require leather shoes. And the purpose for the leather shoes is that liquids go through those not as readily as what they will through canvas shoes or nylon shoes. So make sure that you are in dress code, that you don't smell bad, that you don't overdo the perfume or the cologne, and make sure that you're clean and ready to go. But also have your required equipment. If a watch is required, make sure that you have that. We have to mark each one of the images that we create with what we call a side marker. A side marker has your initials on it, and it has either a L for left or a R for right. So that's to mark the side of the body. It's a side marker. So make sure that you have those, watches, pens, whatever it is that you need. Go ahead and have your breakfast. If you show up again and you're not ready to go to work and you're, look like a mess, and the first thing that you want to go do is to have breakfast, then you're just starting the day poorly. So get there and be ready to go to work. And I'm going to talk about the things that you need to get in the habit of doing when you get there as well. So when you arrive, really this is prior to your first day of clinicals. You want to know where you need to park. So your program is probably going to have some sort of orientation meeting, and you'll find out where it is to park that you're supposed to park before you arrive at your clinical site. So make sure that you scout that out maybe the weekend before you're supposed to start your clinical education. Make sure that you're on time. Account for traffic. Everybody's going to work at 8 o'clock in the morning, so you may have to leave the house just a little bit earlier than what you would on a Sunday afternoon to get to the same spot. But account for traffic, weather, parking lot may be full. Also on parking, make sure that you park in the right portion of the right parking lot. So a lot of your employers will require employees to park in a place that's further out than what the customers, and your patients are your customers, than what your customers would be parking in. So the customer gets the prime parking, so you park just a little bit further out. So be familiar with that. And once you get there, be ready to go to work. So again, if you're fixing your hair, fixing your uniform, and you need something to eat before you can go to work, that's again getting you started on the day on a bad foot. So when you arrive, check in with your clinical instructor, find out what your assignment is for that day. Most of your programs are going to have you assigned to, your clinical instructors will have you assigned to specific rooms or specific technologists. So see if, check in to find out what your assignment is for that day, and then see if there's something that needs immediate attention. And if there is not, and by immediate attention, I'm talking about maybe they're in a trauma and you need to go help. So check with that. And if there's not anything, if it's a slow morning, then you need to get in the habit of making sure your area that you're assigned to is ready to go. So clean it up, rub everything down. Cleanliness should go without saying. Cleanliness is a very important thing in the hospital. So make sure that you rub down all your equipment. Everything that somebody, be it a patient or a technologist, might touch needs to be cleaned multiple times a day. And then stock it. And what I mean by that is every patient's going to get a new pillowcase. Every patient's going to get potentially a new gown. Every patient's going to get a new sheet on the table. So make sure that you have plenty of those available in the room. And then as you start to use those throughout the day, again, get the stock back up. But also some of the stuff that we'll use in our procedures, if you're doing a contrast exam, make sure that you have plenty of the contrast available. Then understand what's expected. Understand the rules, those are policies and procedures. And again, you're probably going to have some sort of orientation, not just to the program, but to the specific clinical site as well. so they can familiarize you with some of the policies and procedures. So you're going to have policies and procedures that pertain to your college, but also to your employer. The equivalent here is the hospital where you're doing your clinicals. So make sure that you understand those policies, understand the procedures. Policies and procedures are different things. Policies are the rules, whereas the procedures are the step-by-step a way to do things. So the procedures in this case are the radiographic procedures. Know what the routines are. If you're doing a chest x-ray, know what views you need for the chest x-ray. If you're doing a hand, same thing. So, and when you start your clinical education, what you need to do is you need to push yourself. Every semester, you need to advance. You need to get better at the things you did the previous semester, and you need to be looking for the new things to do and to learn. So you need to push yourself, and you need to be assertive to do that. So I don't mean be pushy, but be assertive and say, hey, I want to do that chest x-ray. Next semester, hey, I want to do that femur. And the next semester, maybe a skull. So make sure that you push yourself. You can't stay in a comfort zone while you're in education. You make your mistakes in education. Once you become a technologist, they expect you to know this stuff. So just, get comfortable with making mistakes as a student. Know that you'll make those mistakes. Be assertive. Try to push yourself. And try to learn and expand your skill set. So what you should expect from the clinical side is adequate supervision. I'll talk a little bit more about that here in a bit. A chance to learn and to participate, treated fairly. And understand that fairly is a little bit subjective. You should not be abused in clinicals. That does not necessarily mean that everybody is going to have exactly the same clinical experience. Again, back to those personality types, some people are just going to rub each other the wrong way, and you're going to have a tendency to not want to work with certain people, and they're not going to want to work with you, and not want to work well with each other. So we want to make it as fair as possible, as equitable as possible, but more than that, we want to make sure that you're not misused. All right, so you should be taught how to do the job, and you need to understand you're going to be corrected. So back when we used to use screens and film for x-ray, we don't use films anymore. We use a digital capture for our image capture, but we used to use film, and when we used film, we had a higher repeat rate than what we do now. By repeat, what I mean is that we're taking an x-ray image of something that we can't see. So naturally, if you can't see what you're making the image of, sometimes you're going to miss the anatomy that you want to see. And so as a result, we have to repeat some x-rays. And when we used films, the average repeat rate was around 7 to 8% for professionals. So most of the exams that we shot, we got right, but about 1 in 12 we'd have to repeat. So that's professional repeat rate. It's dropped now probably closer to 4 or 5% with a digital capture. There's a little bit more flexibility. But if the professionals are repeating that much and you have never taken an x-ray in your life, then the chances are you're going to repeat a lot of x-rays. So you've got to be okay with making mistakes. You've got to be okay with not being perfect in everything that you do every time. But you also have to be okay with being corrected and being told how to do things right. And if you make the same mistakes over and over and over again, then chances are people will start to get a little bit short with you. Again, back to being treated fairly. Some people are going to get to that point of irritation a little bit quicker. But again, if you're making the same mistake over and over again, then you need to question yourself, well, or am I being treated fairly? Am I being treated unfairly? Or is it a mistake that I should have put behind me a long time ago? So again, it's kind of subjective what being treated fairly means. What to do when things aren't happening? Okay, so when when you're in clinical education, what you'll find is that in a lot of cases you'll have days where you're really, really busy and some days when you're not so busy. So what you want to do whenever you're in a day that is not so busy is that, just like at any other gathering of personnel, people tend to talk. So what you want to do is that you want to stay out of the drama in as much as you can. So whenever people start gathering and talking, and the conversation moves around to gossip and things like that, you want to distance yourself from that. When you're in clinical education, you're part of the healthcare team, but you need to understand that the technologists that you work with see maybe 10 new students every year. So most of the time they don't get real close with you. So if you're involved in all the drama and stuff like that, then even if you're participating in what they're doing, it would seem like you would not be held to a different standard, but you will be. So just try to distance yourself from any kind of drama, any kind of gossip or anything like that. Go back to your room, clean your room, stock it again. Maybe take your textbooks to clinicals with you, and if it's a really slow day, you can get into your textbooks, do some of your studying while you're at clinical education, if your program and if the clinical site will allow it. So when you don't understand something, you can ask questions. Most of your technologists are pretty open to questions, providing you answer properly. All right, so later in this presentation, I've got a suggestion that you not question technologists as under the what not to do. Okay, so that asking questions and questioning a technologist are two totally different things. So you can ask questions, but what you want to do is, first off, you want to wait until you're away from the patient or away from the doctor, and then ask your question in a non-aggressive way. If you ask the question in this context, and let's say you're doing a chest x-ray on a patient and they center a little bit different than what the textbook tells you to center, and you say, well, the textbook says that you should center at T7, and you say that in front of the patient, it's probably not going to go well for you. So what you might do is wait until the patient's gone, wait until you and that technologist are all by yourself, and you say, I don't understand. Why did you do this? This is what we learned. And it's a totally different attitude and approach to it. So ask your questions, but don't ask them in an aggressive way. And don't ask them in front of a crowd, because sometimes a technologist, especially a technologist who's been doing this for a long time, may have forgotten what the textbook says. And they've done what they've done for a long time, and it works for them. So you might want, and therefore they won't have a good answer for you. And if they're in a crowd, it might be embarrassing. So ask your questions away from a crowd, and ask it in a kind of a humble context. And then you're going to learn too that some technologists just don't like questions at all. So you want to ask the technologist unless you get negative feedback on a consistent basis, and then you can ask somebody else. But what I would recommend you not do is take information that you observe from one technologist to another technologist within the department. What I would recommend that you do is maybe go to your classroom instructors, your lab instructors, or somebody who's a part of the program rather than a technologist. If you ask other technologists why somebody does a certain thing, eventually it's going to get back to the technologist, and it's probably going to be an uncomfortable situation for you, both of you, really. So things to guard against, pairing up with other students. And the context of what I'm talking about here is that it's okay for students to work together, but what we see sometimes is a stronger student and a weaker student pair up together and they work together a lot. And what happens then is that the stronger student does the majority of the work, and the weaker student is more like a technologist assistant. So everybody's going to get through this program on their own merits. So, and then you're going to get hired on your own merits, and your employment history is going to be according to your training. So if you're paired up with a strong student and you're just helping that stronger student throughout your educational career, then again, you're going to be unprepared for the workforce by the time you graduate. So if you do work with other students, make sure you share the load. One person will do one patient, and the next person does the next patient, and you alternate the difficult patients as well. So questioning technologists, I just talked about. Also, don't try to show everything that you know. If you walk into your clinical education, you're trying to impress everybody with what you learned in class, again, they're not going to be real impressed by it. They've been through the program. I don't want to say that you need to be a wallflower, but you do need to be a little bit reserved. Watch what's going on, ask those questions in a specific way, and learn. Also, you're going to notice that different technologists do things a little bit differently. So your job as a student is to pick and choose. It's like a menu. Pick and choose what it is that would work for you. Try pretty much everything, and pick and choose what does work best for you, and put that into your toolbox and use those things. So don't try to show everything you know. Don't go back to the technologist and say, well, this other technologist showed me how to do it this other way. It's setting up a conflict that you just don't need to set up. And finally, don't try to become friends with technologists. Some of your programs are going to have rules where if you befriend and start hanging out with technologists, they're going to move you to a different clinical site. You're not there to make friends. Okay, so if you get a job at that clinical facility after you graduate and you become friends with technologists, that's fine, but you need to keep an arm's length distance between yourself and the technologist. And the reason for that is because your program does not want you to set up a situation where there's obvious favoritism. All right. So if you're friends with somebody, then your clinical evaluation is naturally going to come from that technologist, as opposed to somebody else's who's not a friend of the technologist will possibly get a worse evaluation than what you will. So keep the technologist at arm's length. They're probably going to keep you there anyway. So more things to resist doing. So first semester you're going to learn certain things. Second semester you're going to learn different things. You can't decide in your second semester that you're done with what you learned in the first semester. The exam types that you were doing in the first semester, you're going to have to do throughout your clinical rotation. So the things that you're going to hear, or the things that you might say, or it's okay to think them, but if you say them, they're just not going to go over well for you. That's not my job. Okay, so there are certain things that won't be your job as a student, or things that you need constant supervision for. So a delicate way to answer that, but pretty much anything that a technologist might do on a daily basis is your job to learn. All right, so I've been college instructor for a number of years, but before that I was clinical coordinator, before that I was clinical instructor, before that I was supervisor, day shift supervisor, nighttime supervisor, evening shift supervisor, not nighttime. And anything that a technologist could do, I did as supervisor. Before that, obviously, a technologist. So transporting patients, yep. Cleaning x-ray rooms, yep. Emptying the trash, absolutely. So there's pretty much nothing that is not your job. I know that's double negative, but everything is your job. So if somebody asks you to go take an exam in a room, a specific room, or a technologist calls you into a room to do a specific exam, not my room, not my patient, not my problem, is also not going to be, it's pretty arrogant, is not going to be a good outcome for you. So also asking to leave early. So most of your program is going to have multiple clinical sites, and if you're in one clinical site in one town In another town, there's nothing going on, and the day shift supervisor allows the students to go home early. That's really none of your concern. If they release the students early, it doesn't mean you get to go home. If you have some specific reason that you need to potentially leave early, you can ask. But if the answer is no, then you need to be okay with that. For example, let's say your kid, you've got a child graduating from kindergarten, and you want to be there for that. Chances are they're going to let you go for that. So you can ask for it, but just asking because you don't want to be in clinical is probably not a good reason to ask. And then again, friendships, you want to make sure that you keep a distance. And if you happen to be friends with somebody in your clinical site, then you need to have you need to have limitations in place. You need to have what's the word I'm looking for? Boundaries. You need to have boundaries in place to make sure that your friendship doesn't bleed over into your clinical experience. So professional growth, you need to push yourself. You got to do the hard things. You need to push yourself out of your comfort zone and do the exam types that you're kind of intimidated by. You want supervision whenever you have those exam types, but you have to learn to do them. But at the same time, know your limitations. Know when to ask for help. You're there to learn, and you're there to push boundaries, and it's okay to make mistakes, but any mistake that ends in the injury to a patient is absolutely unacceptable. So know your limitations, know when to ask for help, and don't do things that you can't do alone. What I mean by that is it seems like it's a contradiction between push yourself and that, but no, what I'm saying is that if you know for sure you can't do something, have someone with you who can. So make sure that you have your supervision available. So learn from everybody. Again, it's kind of a menu. You're going to take a lot of different things from a lot of different people to develop your own personal style, your professional style. So learn from those people, but don't lean on the students or the other technologists. You have to learn how to do this job on your own. Otherwise, you're just not going to be employable at graduation. And certainly there's learning and repetition. So again, back to the repetition of the exams that you completed in the first semester and the second semester. If you learn something in the first semester and you don't do that again until the fifth semester in the program, that second time that you do it in the fifth semester, you're probably it's going to be like doing it the first time all over again. So there's learning and repetition. This is something that you can't do just by reading in a textbook or being familiar with it. It's a lot of nuance and a lot of art form to making good images. So make sure you get that repetition. Stay busy. Makes the day go faster anyway. It also keeps you out of that gossip loop. So you want to develop professionally, you have to progress, you have to develop those skills, you have to improve your communication. I'm probably going to do another one on communication. So it'll be a 5-part series. And then you have to learn and practice soft skills. So soft skills are kind of personality type skills. And you can develop those. You have a personality, but you can learn the soft skills, which seem to be a personality type thing. So those things will be your communication. I've got a very, very busy slide on that. There are a lot of different things that we consider soft skills. So I'm just going to jump right into it. So these are universal soft skills, which we in education refer to as affective behaviors. So good attitude, dependability, I underline some of them that we see over and over again. Prioritization, communication, reliability, promptness, attitude and flexibility, adaptability and flexibility. I don't know why some of these things kind of shifted to the left whenever I saved this. But so these are soft skills. It's learning to be professional. And again, just like the I guess, for lack of a better word, the hard skills, you can learn your soft skills too by, just observing the people around you. observing the different technologists. You're going to know the technologists that aren't very professional, and you want to take, you can learn from them as well, but you're going to learn what not to be like in a professional setting. But you want to especially observe the technologists that are the technologists that people go to mostly. All right, so the technologists that are the go-to technologists are the ones you want to pick up most of your information from. So observe them, how they behave in front of supervisors, how do they behave whenever the gossip starts, how do they behave in front of the patients, the doctors, what will they put up with, what will they not put up with, and how do they communicate. So those are your soft skills and development of the soft skills. And what, again, later in the presentation, what you find is that your employers value soft skills more so than technical expertise, which might surprise you a little bit. And that is because the people who practice the soft skills are moldable. And, two of the things that, if you ask an employer what they want in somebody, two of the top things are attendance and punctuality. So get me somebody and get me somebody here on time. So technical competence usually comes a little bit further down. If they've got somebody who has a good attitude and gets there on time and does not call out, calling sick on a regular basis, then they consider that person at least somebody that they can work with. So what your clinical site expects from you is a willingness to learn, willingness to participate regularly. If your first, couple of weeks of clinicals, you're probably going to want to be a little bit of a wallflower and just hold back a little bit and observe and see what's going on. But sooner or later, you have to participate. You can't learn this just by observation. You have to put your hands on the patients, and you have to learn to manipulate the X-ray machine. So willing to do as asked, but that comes with caveat that you need to know your limitations. If you're being asked to do something specific and you can't do that thing, then they don't want you to do it. But if it's within your scope, certainly, do whatever is asked of you. Good attitude towards learning, good attitude in general. Don't create drama. Learn and apply what you've learned. So what it really comes down to is traditional values. And I know in this post-COVID electronic world that we live in, we tend to think of things like this as being old-fashioned and outdated, but it really is not. In the hospital, working in radiography, in any specialty in the hospital, you're still face-to-face with the patients, and those patients most of the time are going to be older patients who have traditional values. So those values are still top of the list of things you need to develop. And that's dependability, good attitude, good work ethic, dedication. So good attitude and dedication to the job is still a high priority. So your mutual goal is for you to eventually become a good employee. So sooner or later, the hospital is going to want to be looking at the class and trying to pick and choose which students that they want to offer a job to. It's kind of sad whenever a student gets to the end of their 2 years in program and none of the clinical sites want to hire them because of all those soft skills that we talked about before. They never developed. So they're going to want to look at you eventually to become an employee. They put 2 years worth of training into you and a lot of liability. As a first semester student, we're kind of dangerous, for lack of a better word, but you're truly a liability. You could potentially hurt a patient fairly easily. So they're taking a risk on you, and by the time you graduate, then the amount of time and effort that they've put into you, they see as a benefit if they can pick and choose from the student force to become their workforce. So again, the effective behaviors are the employer's number one desire in an employee, but you actually have to become technically competent as well. You don't necessarily have to be the best student in the class to get a job, as long as you know what you're doing well enough and you've got a good attitude to continue to develop after graduation. If you're in an accredited program, the program is going to be limited in its size according to how many technologists are available to supervise the students. I'd mentioned in the applications video that our accreditation is through the Joint Review Commission on Education and Radiologic Technologists. And what the requirement there is for direct supervision to be a one-to-one ratio. What that means is that you can't have more than one student per technologist. So your technologist or your supervisors will be your technologist, the technologist that you're working with, but also the shift supervisor and your clinical instructor as well. So you've got a lot of different people that you're going to be, that will be observing you. Some of you will graduate from your program, and within a couple of years you may find yourself in a supervisory position. So what you want to do is observe all these different supervisors and base your future supervision style and management style on what you observe. I've worked with some of the best supervisors that a person could hope to work for, and I've also worked with some of the worst. And you can learn from both of those. Just like technologists, you can learn from the good, you can learn from the bad. So what you're going to want to do is you're going to want to develop your own style eventually according to what you observe from the people that you've worked with. If you work with technologists that don't work well with students, they're probably not going to be good supervisors either. And then you want to base your supervision on not being that person. So conflict is unavoidable. Sooner or later you're going to have conflict with somebody, be it with the technologist, the radiologist, hospital staff, faculty, or patients. There's going to be conflict, and you're going to have to learn how to deal with that. You're going to have to develop the professionalism to push past it. So conflict is going to arise, and it may blow up. It might seem a little bit nasty, but you should be able to work through it. So with the technologists, there's a chain of command that you can use to resolve conflict. But always, if there is conflict, the person that you have the conflict with is the person that you need to address any kind of grievance to first. So if you have a difficulty with a technologist, then I would recommend that you talk to that person one-on-one. Again, choose your words carefully and talk to that person and say, hey, I just want to make sure everything's okay. Seems to be some bad air. Is there something that I did that has offended you? Something like that. So address it with a technologist. If that doesn't work, if the issue is kind of beyond repair with a technologist, you're going to go to your clinical instructor, clinical coordinator, eventually program chair if you have to, program director. With radiologists, unfortunately, there's just not a whole lot you can do about it. Your radiologist sometimes just going to blow up. And ER docs, same thing. Surgeons, same thing. It's kind of their go-to mode sometimes under stressful circumstances, is to just kind of lash out. So there's not just a whole lot you can do about that, but again, you don't want to be somebody's whipping child. So, if it seems like somebody has just taken everything out on you, then that needs to be addressed. Hospital staff, faculty and patients, all of that are really hospital staff and faculty. With patients, again, there's just not a whole lot you can do. You can get to a point where a patient is so abusive you absolutely just refuse to treat them. And I've had that situation before as well. So, but that's a pretty dire situation. So to sum up with the soft skills, you want to be there. You want to be there on time. Be ready to work until it's time to go home. Have no expectations of leaving early. If you get to leave early, awesome. That's great. Have a good attitude. Be responsible for any kind of mistakes you make. Just work hard and have a good attitude. And finally, we get to this. So every day is an interview. Again, I mentioned that before. Every semester is a new opportunity. Again, I mentioned that before. Make the mistakes while you're still a student. You're still going to make mistakes when you're a professional, but it's more forgivable to make the minor mistakes while you're a student. So I know clinical education is going to be a little bit nerve-wracking for some of y'all until you get your feet underneath you. But remember, it's okay to make a mistake. Learn from your mistakes and press on. Try not to make the same mistakes over and over again. But if you do make a mistake, be responsible for those mistakes. And again, you can learn from everybody. You can learn from how does the cafeteria staff behave. You can pick up a lot of professionalism off of the housekeeping. How do they respond? How do they talk to different people? Are they doing a good job? I've worked with housekeeping that they scrub the floors with a toothbrush because they're that invested in their job. And I've worked with some housekeeping that would step over a stack of paper on the floor and not pick it up. So observe everybody and build your own professionalism off of just everything that you see. Incidentally, if there's paper on the floor, it's your job to pick it up too. That's also your job. So develop your professionalism based on what you would expect if you were the patient. Would you expect the technologist to step over a pile of paper and say, well, housekeeping needs to pick that up? Or would you expect somebody to bend down, pick it up, and throw it in the trash can?